Dear friends and colleagues, peace be upon you. By the mercy of God Almighty, we are at a point where we see hope to get relief from this COVID-19 or coronavirus. So we have a specialist with us, Dr. Hassan. He was with us almost 6 months ago when he tried to educate us about pandemic and different types of pandemics and how we should be taking care of ourselves with coronavirus. Now, after 6 months, there are hope in the news media, and hopefully we'll have some more additional information from Dr. Hassan. So let's first welcome Dr. Hassan. Welcome back, Dr. Hassan. How's everything?
Good, thank you. Thank you for having me again.
Thank you very much for giving your time, valuable time to educate us. So today we will touch base to some common questions might, you and I or, general people will have. So let's get to the questions. First is, why do you see more infection at this time? I mean, after 6 months later, why it is happening again?
So we have had some, increases in numbers, what we call surges, and then the numbers have gone down. The At the current time, we are seeing a huge surge with increased number of infections throughout the country, including Texas. That's primarily because of the change in weather. With the colder weather coming in, even in Texas, most of the activities are indoors now. So most people are indoors, they are in closer contact. And this virus, which is what we see is spread indoors. It's an indoor virus. You don't spread it when you're outdoors as effectively as you would when you are indoors. Situation is crowded. You are in close contact with the other persons. And then also the humidity and the air dynamics, all of those things make the transmission easier. The other important factor is that we are post Thanksgiving. So anytime there is a big national holiday like Thanksgiving, where a lot of people gather, uh, we are seeing more infections. And we were kind of bracing for that because, even if it's 5 or 10 people getting together, if one of them is infected, he's going to cause 2 or 3 more people to get infected. And that's how you're seeing more infections after Thanksgiving, and that's been described in many parts of the country and the world, where you see the virus is spreading more in family gatherings, weddings, religious events, religious gatherings, those kind of events, and other political events where we have seen nationally also.
Thank you very much. That makes sense. We had election, many, holidays and gatherings, so that makes sense. By the way, dear friends and colleagues, Dr. Hassan is an infectious diseases doctor at John Peter Smith Hospital here in Fort Worth, Texas. In case you didn't see our first interview, you are welcome to go to the library and see our first interview. So thank you, Dr. Hassan. Let's go to our second question. How is coronavirus transmitted? Now that it seems like a common, but are there any special information you can share with us, please?
So it's a respiratory virus. It affects the whole body, but it's primarily spread by what we call large aerosols, so droplet transmission. So if you are within 6 feet or closer to somebody else who is infected, the virus will be spread by droplet spread during coughing, sneezing, or even talking or singing for a prolonged period of time. You can spread the virus. So it's fairly highly transmissible. That's the primary route of transmission. Now, at times it can be transmitted by what we call contact fomites. So if somebody is infected and his body secretions, especially, he sneezes or coughs, and the droplets from his respiratory tract end up on surfaces, and you were to touch that, and then touch your nose or your mouth or your eyes shortly afterwards, because the virus doesn't survive for too long on surfaces. But if you were to do that, that's another way of transmitting. That's why we keep stressing on hand hygiene, using either soap and water to wash, or using alcohol-based hand sanitizers. So those are the two main ways of transmitting the virus. Is by contact. The main one is, of course, the droplet spread, which is by being in close proximity of another person, or is through the respiratory route. When somebody coughs or sneezes, primarily that's the two main routes, and then indirectly also by touching can happen. But that's not as important as the one with the respiratory route.
Thank you. Thank you. That makes sense. And so far, majority of the precautions we have been seeing and trying to implement is cleanliness, especially, hand washing and also covering our nose and mouth. So thank you very much for sharing that. Okay, then the third question I have, what can be done to decrease transmission of coronavirus? We are, very high or peak of this, but still we can learn. So what would be your suggestion?
So what has been recommended for the last several months, which is avoiding gathering. So the three C's, if you can remember: close contact, uh, crowded places, or closed spaces indoors. Those are the three C's. So if you were to avoid those and you were to wear mask, and then when we talk about the other three C's we mentioned, this is basically social distancing or physical distancing. And I guess the magic number we always talk about is 6 feet, but the larger the space between you and the other person, the better. So, and as much as you can avoid crowded places, especially indoor crowded places, um, that's how you can decrease transmission. And hand hygiene, of course. So masking will avoid the. So if you are sick, you will not infect the other person as effectively. So all of those things work together. So doing hand hygiene, wearing the mask, and avoiding close contact, physical distancing, avoiding crowded places, indoor spaces, all of those things work in tandem. They work together. It's not like there's a magic bullet, do one or the other. It's not one or the other. You try to do all of them.
Thank you. Thank you. Yep. Yeah, we need to take precautions, from all angles to make sure that we are, keeping ourselves safe. Thanks for sharing that. And we have some knowledge, and you did also share some information related to the symptoms. But what are the signs and symptoms of coronaviruses now that we are meeting again after 6 months later? Any change or?
Yeah, so it's what we have known about this for a long time. So fevers, chills, body aches, headaches, and combination of any of those, runny nose, coughing, shortness of breath. And sometimes some people have the more gastrointestinal symptoms like nausea, vomiting, and diarrhea. They can have any of all of those also. So those are the main symptoms. But a couple of symptoms which are unique to this infection is loss of smell or loss of sense of taste. Those are fairly unique to this virus. We don't see that in general with other viruses.
Thank you. I think nowadays the testings are more available than 6 months ago. So definitely, somebody, if have those kind of symptoms, should go and test. Have you have any data where there could be false positive reports, or they are always accurate?
So in general, the virus will, the test, the molecular test or the PCR based testing uh, is specific to SARS-CoV-2, which is the scientific name for the virus. So that test is specific. Now, the caveat there is the test can stay positive for a long time. So we do see people who may have had infection 3 months ago, and now they got tested, like sometimes we test people before they are undergoing a surgical procedure or undergoing colonoscopy or some other procedure, and we test them as a screen. They may end up testing positive, and their infection may have been a long time ago, or their infection may be current and they don't have any symptoms or have very minimum symptoms. So that's the only thing to keep in mind, that test can stay positive for a long time. It's still because of that virus. Now I'm specifically talking about the molecular based test, not the antigen test, which can sometimes give you a false positive. Um, but in general, these days, if you see it positive, it's because of this virus. It's generally not a false positive, uncommon, especially with the molecular testing.
Okay, so we should take the results seriously and try to, save others as well.
Yes.
Thanks for sharing that. And is everyone with coronavirus symptomatic? Previously, we heard there might be individuals who might not have any symptoms. Is it still the case, or there has been some new findings?
So there are a significant number of people who may have very mild symptoms, to the point that a lot of us get a mild headache or may have a little sore throat, and we may ignore those symptoms. And some people are truly asymptomatic, have no symptoms whatsoever, and still have it. That's a significant number of people who have very mild symptoms and don't even know that they had the infection, or some people have no symptoms. So that is one of the features of many viral infections, including SARS-CoV-2.
Are those individuals mostly look like is spreading the virus because there's no symptom, they are going to their loved one, without any kind of mask, so do you think that might also causing this infection to go significantly high from these gatherings and other things?
So if you don't have symptoms, you are more likely to not wear a mask, especially with, at home, which none of us wears a mask when we are at home with our close family members. So you are likely to spread because of that reason, because you don't know, and you may spread unknowingly to your colleagues or to your family members. Now, on the other hand, people who have no symptoms or minimum symptoms are less likely to have a higher viral load. So the amount of virus they have is less. So by that token, the risk of spread from them is less than somebody who's coughing and has a lot of symptoms. So that person is more likely to cause uh, infection than others. Again, you can still spread the infection even if you have no symptoms. Yes.
Oh, great to know that. Yeah, the what do you call the strength of that germs to passing into the another person is less likely or less severe, right? The individual who do not have.
Yeah, so you're less
Okay.
symptomatic, you're not sneezing or coughing as much, and your viral levels or the viral load is lower. So you're less likely to spread. Again, we don't know how many virus another person needs to get infected. We don't know the what we call the inoculum, the amount of virus. Yeah.
Right. Okay, great. Thank you very much for sharing that. And all along, we, for the last, few months, we have heard that it is the mostly vulnerable are the, senior citizens over 65, over 60, people with underlying conditions, and maybe children. Has anything been changed in terms of who is at high risk of getting sicker with coronavirus infection and ending up in the hospital at this moment?
So it's the same risk groups which we see with other viruses, especially with influenza. It's the similar risk cohort that gets sicker and ends up in the hospital. Is people with obesity, diabetes, hypertension, cardiovascular diseases, uh, liver problems, renal failure, and other immunosuppressed, and also elderly can get sicker. Again, we do see some elderly who don't get that sick, so there is some variation in there.
What about the children, like, babies or toddlers, or, you're older than toddlers, any changes on their information?
So yeah, there's a syndrome described in kids that they can get sick. It's a systemic multi-system illness, um, but it's not common. So it's not as much of a pediatric disease, although there are well described even deaths. Even in Texas, we have heard of deaths in children, but they are few and far between.
Okay, thank you. And during the last several months, we have seen many individuals got the virus and they also recovered. And the question they might have, or we might have, is there any chance of for them to get reinfected?
So there are well described cases of reinfection. Um, it's not a common event, although they have been described in the literature, but they are very, very few. They're rare cases. Again, it's not easy to prove that somebody is reinfected unless you had the original virus from the first infection, which may have been several months ago, and now they get reinfected and have symptoms. And you isolate the virus again, do the specific testing, what we call the genome sequencing test, to see if it's a different virus, is the same virus. So it's not easy to prove. Now, the test itself can stay positive, and we do see sometimes people get tested several times, and I've had patients who've been tested 10 times, and they may have a positive test, then another positive test, then a negative, couple of negative tests, then have another positive test. And that's not because of uh, a reinfection. So those are not uncommon. I've seen them personally, and others have seen them too. It's very common to see them positive, turning negative, and then positive again, depending on a testing methodology, specimen procurement. How you obtain the specimen. So there are things that make, and the kind of test also. Some tests have higher detection capabilities, and some have less. So yeah, it varies sometimes. So to answer your question, yeah, it is possible to get reinfected, and there have been well described cases. It's uncommon.
Okay. Oh, yeah, yeah. That's very helpful because some might think, oh, I got the virus once, I'm immune to it forever.
Yeah,
No, there is a chance, right?
there's a chance. Yeah, we don't know how long your immunity lasts. Nobody knows that for sure. We think it lasts for some time. We say that in general. We say that within 3 months of getting the first infection, you are protected from getting reinfected in general. Unless you are immunosuppressed, you have some kind of cancer or transplant and are immunosuppressed because of that. In general, we say you are unlikely to get the infection within the 3 months of the first infection, but can you get it afterwards? It's theoretically yes, and there have been cases that have been described in the literature that yes, people do get reinfected.
Oh, great to know that. Thank you very much for sharing that. Now, some people, might get that virus and they test positive, but, they're not too sick that, they have to be hospitalized. So individuals like that, how can they take care of themselves at home without, creating more danger for their immediate family members or, other individuals they are with?
So if somebody is not, so let's see. So how do they protect their loved ones? So if you have symptomatic, if somebody's symptomatic or have tested positive, they need to what we call self-isolate at home, and not go outside also, like using public transport or other indoor areas where they can transmit the infection to others, and do the same thing at home also, stay in their area and not transmit it to their family members. And they should do that for um, at least 10 to 20 days, we say in general, depending on how sick they are, to avoid transmitting it to others. Um, and how do they take care of themselves? So if they're mildly ill, meaning they have fever or cough, but they're able to breathe and their oxygen saturation is not low, they're able to maintain their hydration, meaning they're able to eat and are able to take care of themselves at home and can be monitored. Sometimes we use home oxygen monitoring also to make sure their oxygen level is staying at a certain level. Those people can stay home and not necessarily go to the hospital.
Okay, so in terms of their food taking or any kind of medicine taking, they want to make sure that they are not exposing themselves to other family members, and they maintain 6 feet when they're getting the
Right.
foods or other medicine or any kind of help they would need, right?
Yes.
Great. And at what situation someone needs to go to the hospital or primary care doctor? I mean, sometimes it is very difficult because, early stage, they might feel like, oh, I'm doing okay. I don't need to hospitalize myself. Middle of the night, their fever might go really high or something can happen in combination of this virus. So if they have isolated themselves, they are now, don't you think, a little bit danger if, not getting monitored?
Yeah. So when do you need to go to the hospital would be if you are just having more chest symptoms, especially if you're having difficulty breathing. That would be one situation where you would need to go to the hospital and may have to be monitored and may undergo some testing to make sure uh, you don't have severe pneumonia or oxygen requirement. And then they will give you also treatments, uh, including steroids and some other treatments they may give to you at that point. So yeah, it is especially if you're having difficulty breathing and you're not able to maintain your oxygen level, uh, or you're sick that you're not able to keep yourself hydrated. Your food intake is not good.
So oxygen level, I mean, do we need to, do those individuals need to get some kind of equipments which will tell them what is their oxygen level?
Yeah, there's again they're kind of more expensive these days, but not that expensive. It's called the oximeter, pulse oximeter, where you can just and they use it in the offices and hospitals where you can check your oxygen saturation. That's
Okay.
what we are monitoring, and then a lot of hospitals do that and clinics do that. That they monitor patients who are tested positive, and they order pulse oximeter for them, and they can monitor their oxygen level at home.
Great. Thank you very much for sharing that. And now that, after 6 months and we see vaccination is an option, and I think UK already started, United States is about to start. So some individuals are also asking the effectiveness of these vaccines. Can you provide more information, like what different types of vaccines out there, who is making it, and should we be any careful about, taking some vaccine versus the other vaccines?
So the two vaccines which will be looks like will be available shortly in the US, the Pfizer BioNTech and the Moderna vaccines, they are upwards of 90% effective in producing the immunogenicity, the antibody levels after you've received the first dose and the second dose, which is usually 3 weeks or 4 weeks after the first dose. Those vaccines are highly effective.
So when we say, I mean, it's like 96% or 97% effective. So if somebody, 100 people take vaccine, there is still chance 3 or 4 individuals from that pool can get the virus, right?
Yeah. So it's still very effective, and we'll see how it decreases transmission. We don't know if it will. So how many people will have to be vaccinated before we'll actually see decrease in transmission of the virus? So yeah, so it will be starting soon with the first phase of vaccination with some of the higher risk groups, and then will be more widespread availability of the vaccine.
So the key indicator researcher and policymaker would be looking at the infection rate, whether it comes down and it goes down, right?
Yeah, so there will be studies after vaccination also, see how the epidemiology changes. Again, there's a combination of things that are happening at the same time, right? The weather change, like I mentioned earlier,
Right.
masking, all of those other things that we are implementing or supposed to be implementing should continue. And this will be another layer of uh, hopefully beating this virus.
Okay. Well, last question. If somebody get vaccinated, do you still request them to wear mask?
Yes, so they should still continue to wear the mask. Yes. So yeah,
Okay.
that's an important point
Okay.
to make. Yeah, that not a yeah. So you don't want to stop wearing a mask.
I see, I see. Okay, I think that's the end of all the questions we had, and we really appreciate and pray for you. So may God Almighty keep you and your family safe. You are in the front line of defending us from this disease, and thank you very much. We really appreciate your time and your services. Thank you.